last biology of HIV. Moving on, if we look at who are the priority populations for the National AIDS Control Program, so you know that infants and children, specifically infants and children born to HIV positive mothers, so they are priority populations. Next, adolescents. So adolescents, you know that age group 10 to 19 years, they will have various sexual explorations and they do not have ready access to contraception. So there can be transmission. So under the, in collaboration with the Rashtriya Kishore Shastra Karyakram, which is the RKSK, which is the dedicated program for adolescents, there will be screening services that will be available for the adolescents also at the RKSK clinics. Okay. So, but remember that for testing adolescents, informed consent of the parent or the guardian is required if they're less than 18 years old. Okay. Next, pregnant and breastfeeding women. So, pregnant and breastfeeding women, if they're living with HIV, the risk of transmission is 20 to 45% from the mother to the child. Okay. So priority screening of all pregnant women for HIV, very, very essential. Healthcare workers, occupationally, they can be exposed, occupational exposure to needle stick, to splash of body fluids, needle stick injuries, all of that can happen. So healthcare workers are a priority population. Emergency settings, similarly, trauma, uh, again, blood, yes, splash of body fluids or blood. So those are priority settings of infection prevention and control. Moving on, patients living with TB or Kala-Azar. Okay, both of those are, there are TB, HIV is very prevalent. Also, patients having Kala-Azar are especially vulnerable to develop HIV. So both of these are high risk groups and they need to be screened for HIV. Any person attending STI or RTI clinic and seeking treatment, so they need to be screened for HIV. Sexual partners and spouses of people living with HIV, they need to be also screened for HIV at regular intervals. Nextly, high risk groups. So female sex workers, male having sex with males, injectable drug users. Okay. So these are high risk groups for um, transmitted infections and HIV. Breach populations. So the migrants and the truckers, these are known as breach populations because mostly what is happening is when they're migrating, they're leaving behind their family or their partners. Truckers also, when they're migrating, when they're driving trucks over long distances, they're leaving behind their partners or their wives, and then they will be the ones who will many a times be involved in injectable drug use or in male having sex with male, or they will seek services from female sex workers. So these two are considered breach populations, migrants and truckers, and high-risk groups, which is female sex workers, male having sex with males, injectable drug users, and transgenders. Nextly, prison inmates and persons who have undergone sexual assault. Okay. So all of these are priority populations for counseling and testing services under the National AIDS Control Program.